I'm Dr. Corbett Weiniger. I want to introduce the Vascutherm machine. Now this is an iceless ice machine and a DVT prophylaxis machine that squeezes your calves and helps prevent blood clots. I use this machine after every total knee replacement and sometimes after ACL reconstruction, and it's important for helping with blood clot prevention, swelling, and helps with pain and decrease your narcotic use. You'll get this machine and you'll bring it home. It will be in a package just like this. You can wheel it in. I want you to bring it in by your bed, and I'm just going to introduce what's inside this bag. You'll unpack each one of these components. In here is the umbilical cord. There will be a power cord. And then within this box, a couple of packages of wraps. These are your calf DVT wraps, and then your ice wrap. And you all have your machine that I'll introduce. And refill solution. This is special alcohol water solution that runs this machine. Now this is iceless, which means it's actually a refrigerator. So you can't pack anything covering these vents, otherwise it'll overheat. So it uses its own solution in refrigeration to cool your cooling pads. Okay, so how you set up this machine is you first take your power cable, plug this end into the side here, make sure it's securely fit. Then you plug in your plug into the wall. Now typically I would have this machine on the floor, a little bit away from your bed, but at least 2 feet surrounding it, no blankets or pillows or anything. Then I would take this umbilical cord. Now these cords are different on each side, and the ones that go into the machine are the ones with the 3 male plugs, and they just push in and they click in. They're a little bit stiff, so they click. You can see how the snap clicks. When you get them out, you push that button to pull it out, but make sure they're clicked in. Next, you take the other end and you put it into your ice pad and click that into here. All 3 of those. So your next wraps are the DVT wraps. These go on your calf. So there's 2 of them. And if you open these, pull out the hose, and these blue ends go into the front of this machine. Into these, there's kind of an orange ring on those, and they just push in. They don't click, they just kind of fit in there together. So I do both of those wraps, stick into each one of those. So it does not matter which wrap goes into which hole, just either one works fine. So I'm going to use my son Bear as our patient today, and I want to show you how to put the pads and wraps on the knee. So you have to have both calf wraps on and the ice wrap on at all times. All 3 wraps have to go, or the machine will give you alarms. First, start with the calf wraps. Now the hose should be in the back around the calf. It should go below the knee, kind of on the calf muscle. This would wrap here, and each one of these straps would go around the calf like this. I don't want it down on your Achilles tendon. I want it above there, so it's kind of on the muscle. Now it shouldn't be too tight, but not too loose. It should be able to sit there fine, but maybe a finger in there. And then I put both calf wraps on in the same way. Make sure these stripe pieces are in the back on the calf. That's probably a little too loose, so I'll just tighten it a little bit. Once that's on, this is the operative leg, so I'll take this next wrap and I'll put this plastic side down, and these hoses go down that direction. So once you have this in position, then you've got 2 kind of rubber band straps. And this would stick here, and it goes underneath the thigh. You can stick it on itself. And then this one does the same thing. And stick it on. Now this is the proper way to have these 3 wraps. And if you have it like this, you shouldn't have any problems with it. Once all the wraps are in place, then we can turn it on. Flip the switch to the on in the back. You'll hear this machine start up. And if you look at the screen here, all we do is hit start. All you're really going to do on this is stop and start. You're not going to need to mess with anything else. Everything is all preset. You'll hear this going, and I know it's kind of loud, but you'll get used to it. Don't cover it with any blankets or pillows to make it more silent. Once this is running, what you'll expect is each one of these calf squeezers will compress, and they inflate to about 45 millimeters of mercury. So it's not really, really tight, but it can compress your calf in the back. And one will go, and it'll turn off. And then the next one will go, and it'll turn off. The next thing that this does is this part of your knee actually cools down. The cold water goes through it and cools it down. But this also inflates with air and compresses and decreases swelling. So all three of these go at different times, and you'll feel all these experiences. Now, at first, I'll have you in an ACE wrap. I want you to take the ACE wrap off after a day or two so that you'll feel this cold through. So the ACE wrap will prevent the cold from going through. So if you take the ACE wrap off, you'll feel this better, but I don't want you to take your Band-Aid off, the dressing off underneath. I want that incision to be covered all the time. If you have to get out of these for some reason, or at least stop your therapy for a little bit of time, you come and you hit stop. Then you can take off your wraps. If you take off your wraps before you hit stop, then the air fills up in these baffles and it makes it be a big balloon. So you take all that off, and then you can go to the bathroom. If you forget to turn off the machine and these fill up with air, these can fill up with air and it'll give an alarm on the machine. You just need to pull out the plug here and then squeeze the air out. On any of these, you squeeze it so the air goes out, make it flat again, and then plug it right back in and start over again. And the same thing for this. This will fill up with air. If this one fills up with air, you stop the machine and you actually unplug the middle button. So see how there's three plugs. This gray one is air. So if you unplug this middle one, then you'll be able to squeeze the air out and then plug it back in. And then it's ready to start again. So when you're using the CPM machine and the Vascutherm device with the calf compression, this is what it looks like. You'll have your motion machine moving, your ice and compression on your knee, and your calf devices on both legs. It will have all your hoses that come down to your station where you're going to have your power outlet. And this will be running. I'll hit start. And this is how I want you to be. The protocol for the CPM is 4 hours a day, broken up. But the ice wrap and the compression sleeves, I want you to use that every time you're in bed or sitting down. If you're up walking, you don't need to have it on, but otherwise, I want it always on. So your iceless ice machine runs on an alcohol water solution, and it is unlikely, but maybe you'll need to refill some of the solution, and I will send you with an extra bottle of the solution. To fill this up, this is the fill cap, but you have to have the machine running. So I'm going to hit start. You'll hear that once it starts cycling, then you can take the cap off. If it's not on and cycling, you don't want to take the cap off, it'll overflow. So now you can hear it cycling. I can take this cap off. And if you look down into this hole, you can see some of that fluid. And that's a good enough level. It's up high. But basically, if it's down low, you can take some of the fluid that I'll send with you. Just pour a little bit in there. Try not to spill it. And then replace the cap. And that's all you'll need to do. So when you need to get out of your whole machine to get up and go to the bathroom or whatever, you have to stop both machines. So first, stop your Vascutherm machine. Then stop your CPM machine. I'd wait till it's in a reasonable position, like 30. Hit stop. That stop button. Start with taking off the knee wrap. When I take that off, I fold it over so it doesn't stick onto things. Fold it over. And then that wrap can come off. Set that aside. And then you have your other wrap. This is why you need help for the first couple of weeks, is because this is difficult to do on your own when you are in pain from surgery. So take that one off, and then this one can come off. Remember, you always need all three on or off, or it'll alarm. Okay, so come out of the machine. You'll have somebody help you, and you can kind of turn to the side, and you can get out of bed. So when you're done with the Vascutherm and ready to bring it back to BlackRock Orthopedics, this is how you pack it all up. So it's already stopped. You flip the stop, the power button, which is this red button on the side. Turn that off. You unplug the cord. Unplug the cord here. Roll it up nice, and then put the alcohol. Here's the alcohol thing, goes in this pocket. And then this is actually going to stick on the side here. To unplug these hoses, I push the little silver tab on the top. And it comes out and kind of come up together. And these blue ones just pull out. Now these do leak a little water, that's okay. This button and that one. Now these wraps are yours to keep. They are one-time use, but this black umbilical hose needs to come back. And so this machine, this lid should be on tight. It goes in this space. So you can see the machine, the cord, and the solution. And then in this outside pouch, we'll put the umbilical hose like that. And then this should be all ready to be transported back to our office.